Hey everybody, it's Dave Juno, the Meniere's Disease Warrior. How you all doing? I'm doing pretty good for Monday. I hope you are too. I hope you had a great weekend. We get a lot of people who ask questions about red light therapy. If anybody's tried it, has it helped? Has it done this? Has it done that? And so I decided to look it up. And really, what laser, I'll get to laser in a minute. Red light therapy is the red light is actually a diode that shoots red light. Just like if you see the RGB lighting, those are all light emitting diodes. Okay, they're very low, but they're bright enough that you can see them. So they're all light emitting diodes. In the laser unit, now I did a lot of work in on office equipment, digital printers, copiers, duplicators, things like that. They use a light emitting diode too, a laser, and that writes the image on the drum, and then the toner and all that. So I can do a 4-day video about that. But that they use lasers. So, and it's a light emitting diode. So it's a light emitting diode that is supposed to re-energize cells, possibly regrow hair. Either some I guess dermatologists use it for bald patients like me, but I shave my head, and that's a different reason for that. But they use it for like skin problems, acne, things like that. If you want to get rid of wrinkles, things like that, I guess it works for. Um, but and it can regrow the hair. When I said the hair, the cilia, little hair follicles in your side, your inner ear. So I decided to look it up, and yeah, they can you can do it. You can help with Meniere's with it. Now it's not a cure. If you go someplace and they do this red light therapy and they say it's going to cure you of your Meniere's, run. It's only to manage your symptoms. It doesn't cure it. Okay, but what they do is they have this wand thing. You have to go someplace to have it done, and you put it in your ear. They put it like right up against your ear, and it's supposed to regenerate the cells. Re-energize them, help grow the hair and blood flow, which is what beta histine does. Increase the blood flow in the ear and all that stuff. But the thing on the bottom of what I was researching said that beta histine actually works faster. It's not something that you do it once and you're fine. You've got to keep going and keep going and keep going and keep going. Now, when I first originally looked it up, which was a couple of days ago, the only medical doctors I really could find who were talking about it were dermatologists. And they said it worked great for acne and it worked great for wrinkles and all this stuff. I found some things for Meniere's disease, but they were by wellness centers that are basically chiropractors. Um, not medical. Which is what I was finding. I could be wrong, which I'm the first one to admit when I'm wrong. But there have been tests on this, like from 2008. Okay, so almost 20 years ago, um, that they were testing red light therapy on Meniere's disease. That was in the National Public Health. They were running pilot programs to test it and things like that. Um, the other thing said is I don't forget if I didn't mention it, if I forgot to mention it. Um, it does help with Meniere's disease and general vestibular dysfunction, though it acts slower than some meds like beta histine. You'd have better luck with beta histine getting the blood flow going in the ear, increasing it quickly or quicker than this. This would take like almost 3 to 6 months before you'd start seeing things. Um, but yeah, it's also supposed to stimulate the nerves in there, hair cell repair. Um, it can help regenerate inner ear hair cells damaged by treatments like gentamicin, improving function. Um, Many studies suggest, light emitting, whatever they call it, LLLT, helps prevent vertigo spells, though it might take longer to show effects than beta histine. And that was a few places I found that. It does help with vestibular dysfunction, and they said it could, with longer application times, showing better results for tinnitus. So people are asking about tinnitus. It might be something to try. Why not? I think actually you might be able to buy, like, and I'm not talking about the people who are trying to sell those hats and things like that. Go on Amazon. I'm sure you'll be able to find something. You could try it, see if it helps. For the tinnitus, you sit there 20 minutes a day. Or you could go to, one of those health centers that do it. There's a lot of them, I guess. There's like one in Southborough, Mass., another one in Marlborough, where I live. And I think my friend Jeannie, she's got a wellness center. And I think she does it too. I might actually mention it to her. What to know? It's non-invasive. There's no drug. There's no surgical approach to it. It works through photochemical effects using infrared light to simulate deep tissue, which, laser. Okay, but it's not a strong laser. It's not something that's going to burn a hole in your ear, won't even burn a hole in a table. It's very, very light. Like you won't. I mean, you could probably put it. I wouldn't put it in your eye, but you might be able to just go like this with it real quick, and it probably wouldn't bother you. Complementary, often used alongside other treatments for vestibular rehabilitation. And the one thing about it that I actually do like is there's no side effects. It's not going to harm you. So if you do try it, right, it's not going to bother you. It's not going to harm you. You don't have to worry about it. Unless you go to some ding-dong who's got the high-power laser and says, I can make it work in 2 days. There's another thing here. Why don't doctors recommend red light therapy? Although red light devices are considered safe, we don't know the long-term effect on the skin or the hair. That makes sense. I'm sure if you're using it, every day, 5 times a day for 20 minutes a time over a year, yeah, that's probably not good for you. That's like getting an X-ray 3 to 5 times a day for the next 6 months. You'll probably end up with cancer from radiation. But it's worth a shot. It's not something I would say don't try it. I would say, yeah, go ahead. See if it works. I mean, to be honest with you, after doing all this research, I'm actually thinking about it for my tinnitus. But I got a doctor's appointment on Thursday, so I'll mention it to my doctor and see what she thinks. Because she'll probably say, well, try it, but it's not going to hurt you. That's the best thing I could tell you is there's no side effects with it. Okay, like with other things, like beta histine, even though it does work for a lot of people, there are side effects for it. I mean, you get side effects. Okay, so gentamicin causes hearing loss. Labyrinthectomy, hearing loss. That's why I'm totally deaf on this side. Well, thanks to a little help, I'm not anymore, but without it, I am. Even steroids can have side effects. Meclizine can have side effects. I mean, anything really. I mean, this is Allegra. This has side effects. It actually says it could cause dizziness. I mean, I had to take it this morning, but just because we bought my granddaughter flowers yesterday for acting in a play, and of course, I think it's the only thing I'm actually allergic to, because I got all plugged up. But, yeah, I mean, the other thing, too, you can understand is, and that was in this, too, that I researched, don't be surprised if it doesn't work. Go into it being realistic, not fantasy world. Okay, because in a perfect fantasy world, everything works. Not in reality. Go in it with real expectations. Okay? One is just to help you with the symptoms of vertigo, tinnitus, hearing loss, vestibular dysfunction. It's not a cure. And that's the one thing we have to realize. It is not a cure. Okay? It's to help relieve this, help with the symptoms. Just like my sac decompression. It stopped one symptom. I still have all the other ones. My ears right now, especially the left one, it gets red a little bit. But yeah, the tinnitus is booming today. I don't know why. So yeah, it's not a cure, but it will help you. You know, because we all want that quick fix. We all want that now. And unfortunately, with Meniere's disease, we can't have it now. We have to wait. But I can see in a few years, there's going to be there's going to be some big improvements in how they treat this disease. Especially with medications, like the Epsilon, there's the steroid, the dexamethasone, that's a gel, which I like that one a lot because it's a gel. They inject it in and it stays there for a while. It's not like the regular shot where it's the fluid, it hits it, it absorbs, that's it. This stays in there for a while, so there's a constant feeding of that dexamethasone. They're developing that. I don't know if they have it out yet or they're in the process of doing it. So there's a lot of things that are going to come out in the next few years that'll make our lives a little easier. So my thing about red light therapy, give it a shot. There's no side effect. That's all I'd say, no side effect. But have realistic thoughts about it. It isn't going to work after a day or a week. It's going to be like 3 to 6 months before you'll notice a difference in symptoms and things like that. Especially like increased blood flow. Beta histone is a lot quicker than that. I think a diuretic might be a lot quicker too. But hey, if it's going to increase the blood flow and you're willing to be patient with it, go ahead and do it. So, on that note, have a great night. I'll talk to you all soon. Bye.